Socially used drugs. Caffeine. Caffeine improves performance through a variety of ways. It improves endurance due to an increase in muscle lipid oxidation. This means that there's an increase in fatty acid use. This is a glycogen-sparing effect. Caffeine stimulates sodium-potassium ATPase activity and increases skeletal muscle calcium. And the theory is that this contributes to enhanced skeletal muscle contraction. Caffeine increases mental alertness, which decreases the perception of fatigue. It also increases motor unit recruitment. Caffeine binds to the adenosine receptor in the brain. Caffeine is an adenosine receptor antagonist. Adenosine normally depresses nerve cell activity, which causes drowsiness, and caffeine inhibits this action, resulting in mental alertness. Caffeine blocks phosphodiesterase, which inactivates cAMP, prolonging the sympathetic effect, increasing free fatty acid utilization and sparing glycogen. Caffeine is only banned by the NCAA when urine levels exceed 15 micrograms per milliliter. Alcohol. Alcohol has many detrimental effects on exercise. The following are some of the main effects. It inhibits gluconeogenesis, which is the formation of glucose from non-carbohydrate sources. It accelerates fluid loss, resulting in dehydration. Alcohol inhibits the release of antidiuretic hormone, which increases the excretion of urine through the kidneys. It diminishes protein synthesis and inhibits the absorption of B vitamins. Marijuana. Cannabinoids are psychoactive compounds found within the cannabis plant. They are fat-soluble compounds that can be stored in fat tissue, cell membranes, and the brain. THC is the most well-known and studied cannabinoid. THC inhibits normal vagal tone, which results in an increased heart rate, which is a positive chronotropic effect. Heart rate usually increases about 20 to 50 beats per minute after the acute use of cannabinoids. Cocaine. Cocaine has amphetamine-like properties and can give the perception of a decrease in fatigue. This is the common reason for its use. Cocaine also increases heat production, diminishes heat loss, and can impair temperature regulation, actually decreasing exercise performance. Cocaine does not impact protein synthesis. Remember, cocaine has also been shown to deplete glycogen stores and cause lactic acidosis during exercise. Amphetamines. Amphetamines are sympathomimetic amines and are similar to ephedrine. It's similar to epinephrine, enhancing the fight or flight effects. They bind to alpha and beta adrenergic receptors, resulting in a sympathomimetic effect. The effect is similar to that of cocaine, but longer acting. They increase heart rate, cardiac output, respiratory rate, metabolic rate, and increase the release of dopamine. Signs of amphetamine use include dilated pupils, dry mouth, lip licking, restlessness, reduced appetite, weight loss, irritability, mood swings, tremors, anxiety, rapid speech, talkative, and hallucinations. These are all signs of amphetamine use. Both cocaine and amphetamines impair thermoregulation and increase body temperature, which can lead to heat stroke during athletic events. Quiz yourself. Which two socially used drugs decrease the perception of fatigue? Caffeine and cocaine. When does the NCAA ban caffeine? When urine levels exceed 15 micrograms per mil. Which of the following is not considered a stimulant? Amphetamines, ephedrine, alcohol, caffeine. Alcohol. Which of the following is not an effect of amphetamines? Increased blood pressure, increased heart rate, increased respiratory rate, decreased release of dopamine, increased cardiac output. Decreased release of dopamine. The release of dopamine is increased. Dopamine activates the pleasure center in the brain. The mechanism of action of caffeine is as an adenosine agonist. True or false? False. Caffeine is a competitive antagonist to adenosine. It competes for the adenosine receptor but does not activate it.